If mouth sores or pain from treatment are making it hard to eat, you're not alone. Nutrition still plays a big role in how you feel during treatment. Let's walk through what tends to help, what usually makes things worse, and how to eat when your mouth doesn't cooperate. Chemotherapy and radiation target rapidly dividing cells. Cancer cells divide quickly, but so do the cells that line your mouth. When those healthy cells are damaged, the tissue becomes inflamed, fragile, and painful. This is called oral mucositis. Oral mucositis is inflammation and damage to the lining of the mouth and throat. It's common with certain chemotherapy drugs, and especially common with radiation to the head and neck area. With chemotherapy, symptoms often start about 5 to 10 days after treatment begins. With radiation, symptoms usually appear 2 to 3 weeks into therapy. Mucositis can range from mild sensitivity to severe pain that makes eating extremely difficult. The goal isn't to eliminate discomfort completely. That's often not realistic. The goal is to reduce pain enough that you can stay hydrated, maintain some calorie intake, and lower the risk of infection or significant weight loss. When the lining of your mouth is already damaged, certain foods and drinks can make pain worse. Most of the time, the problem isn't the food itself. It's the texture, the temperature, or the irritation it causes. Anything acidic can sting open sores. Even foods that are normally healthy can burn when the tissue is inflamed. Spicy or heavily seasoned foods can also trigger discomfort, sometimes more than people expect. Rough or hard textures tend to scrape sensitive areas. If a food feels sharp, dry, or crunchy, it's more likely to cause pain. Temperature matters too. Very hot foods or drinks can irritate fragile tissue. Letting foods cool often makes them easier to tolerate. Alcohol and tobacco slow healing and raise the risk of infection. They're best avoided during this phase. Sugar doesn't directly cause mucositis, but high sugar foods can encourage infections that make mouth pain worse. These restrictions aren't permanent. They're temporary tools to reduce irritation while your mouth is healing. When eating hurts, the goal is to reduce friction and irritation as much as possible. Foods that work better are usually soft, smooth, and easy to swallow. Texture matters more than variety. Softer foods tend to be easier to tolerate than anything dry, rough, or crunchy. Blended or pureed foods can help when chewing is painful, especially if they're well moistened. Adding liquids, sauces, or healthy fats can make foods slide down more easily and add calories without increasing volume. If chewing feels like too much, you don't need to force it. Liquid nutrition, like shakes or smoothies, can provide calories and protein with far less effort. Temperature can make a difference too. Very hot foods often irritate sensitive tissue. Cool or room temperature foods are usually easier to manage. Some people even find colder items temporarily soothing. Protein is still important during treatment. It supports healing and immune function. If solid protein is difficult, protein-rich liquids or soft options can help meet your needs. You don't need large meals. Small amounts taken frequently add up over the day. Hydration is just as important. When swallowing hurts, dehydration can happen quickly. Sipping fluids consistently is often easier than trying to drink a full glass at once. If plain water isn't appealing, broths or non-irritating drinks can help. If carbonation causes stinging, it's okay to avoid it for now. Small changes can make eating a little more manageable. Some people find that using a straw helps liquids bypass more sensitive areas in the front of the mouth. It doesn't work for everyone, but it's an easy thing to try. If your care team has prescribed a numbing mouth rinse, using it shortly before meals can take the edge off pain. It won't remove discomfort completely, but it can make eating more tolerable. Smaller amounts, eaten more often, are usually easier than full meals. Instead of focusing on 3 meals a day, think in terms of gentle, frequent intake. Mouth care matters too. Rinsing your mouth after eating helps clear food residue and reduce irritation. Plain water or simple saltwater rinses are usually best. Avoid mouthwashes that contain alcohol. Keeping your mouth clean also lowers the risk of infection, which becomes more important when the lining of the mouth is damaged. Using a very soft toothbrush or gentle oral swabs is often better tolerated during this phase. There are times when mouth pain needs medical attention. If swallowing liquids becomes difficult or you're struggling to stay hydrated, that's a reason to call your care team. Ongoing weight loss or being unable to meet basic nutrition needs is another sign to reach out. White patches inside the mouth can signal an infection that needs treatment. If pain isn't controlled with the medications you've been given, let your team know. And if you develop a fever or any signs of infection, contact your care team promptly. Your oncology team has options. They may adjust medications, prescribe stronger mouth rinses, or recommend temporary nutrition support while your mouth heals. Needing this kind of help is not a failure. It's a routine part of supportive care during cancer treatment. Oral mucositis is usually temporary. For most people, symptoms begin to improve within a few weeks after chemotherapy ends, or in the weeks following radiation. Until then, focus on what your mouth can tolerate, not what you think you should be eating. Gentler textures, comfortable temperatures, protein when possible, hydration whenever you can. Small, consistent steps matter more than forcing full meals. More practical, supportive care guides like this are coming soon.